Good morning, Carbon County. Thanks for joining us. This morning we have our third panel discussion with nursing leaders from across the county, as well as representation from MHCC and Carbon County School District number 1. So again, thank you for joining us, and we're going to go ahead and get started here. We have Jacqueline Wells with Public Health, Christina Baugh with Memorial Hospital of Carbon County, Jessica Penman with Sinclair, Mike Hamill with Carbon County School District number 1, Ken Harmon with Memorial Hospital of Carbon County, and we also have Amber Waldron with the Sheriff's Department. So with that, we're going to go ahead and kick things off. Christina, would you like to lead us off this morning?
Okay. We've all the nurses you see here, as well as others that have not been able to attend, are very diligently busy making sure that our community is safe. My hospital would like to thank personally Janessa Mann. She is doing a wonderful job at keeping all of our residents at the nursing home, as well as the Saratoga nursing home, safe. And we applaud her efforts and also what they are doing at the nursing home. We would like to thank Amanda Brown and Jackie Wells for their contact investigation, their information that they are sending out. We feel it's important that everybody stays informed and up to date with real information, not fake information. There is a lot of it out there. Hopefully we can help disseminate some of that information. The Carbon County Jail, we have Amber Waldron, who has put a lot of processes into place to make sure that all inmates that are here are safe, as well as the staff. And the Carbon County School District, who is represented today by Mr. Hamill, all those nurses are also coming up with processes. So one of the things our hospital wanted to make sure is that you understand that every one of these nurses, as well as all the nurses at our hospital and all the staff, are working hard to keep our community safe. On a personal note, I guess I'll just say it and get out of the way, and my CEO does not know, but he knows me. Every nurse you see here does not have a political agenda, and we need to make that very clear. Our only agenda is keeping you safe. We work day and night. We have put our families and our personal things aside. We're not asking for anyone to feel sorry for us or anything. That is what we do. That is why we came into this field. And we feel this time, more than any, we need to work together to make sure that you have the right information, that you have the tools you need to stay safe for you and your family. We understand some of the things we say are an inconvenience. We understand it's a frustrating situation. And life, unfortunately, as we knew it in December, has changed. And it will probably change for the foreseeable future. But please know, we tell you what we know to be true. We give you that evidence that we can, the best evidence we can that is backed by science. And I admire every person that is here, every person that is here, every nurse I've talked to, I've spoken with, I've worked with, every EMT, from fire department, from Saratoga to Wamsutter to Bags. There is an enormous amount of people working for your safety. And I ask that you appreciate their efforts, that you not hamper their efforts. I understand we all have our individual beliefs, but that is not what this is about. And I think it is very important that you support the people that you see in front of you and not hamper their efforts. You may not agree with them, but we are doing what we feel and what we have been taught is right to keep our whole community safe. I don't know how best else to say that. I wish I was more eloquent about that, but I felt it was just really important to begin this with everybody know. We will answer your questions today as honestly as we know how, and if we don't know the answer, we're going to tell you we don't know the answer, and we will try to find it for you if there is an answer out there. But know this disease, what we learn, changes every hour of every day. So what you hear or heard at our first meeting is not the same as what you may be hearing at this meeting. And it's not because we're being untruthful. It's not because we're being dishonest. We learn as the rest of the country learns and try to get that information out to you. So I'll turn it over to Jackie.
Thanks, Christina.
Mm-hmm.
I just wanted to do a little situational update. We are currently, for the state of Wyoming, at 415 lab-confirmed cases with 144 probable cases. And so what a probable means in terms for the state is that they've had some connection with a confirmed positive case. So they're already saying that those are a case. So if you total that up together, that is your true number of how many we have statewide that we know about. We currently have 7 deaths in the state of Wyoming. We have 5 confirmed Carbon County cases. Now 2 of those were people that are from Carbon County that live elsewhere or that are housed elsewhere right now. And then we have 4 confirmed out-of-state residents that are living in Carbon County that have tested positive with COVID-19. For the state of Wyoming, we have 373 recovered, and for Carbon County, out of our confirmed cases, we have 4 that are recovered. We are currently, through Carbon County Public Health, monitoring 60 people with COVID-like illness. So that means they have the symptoms of COVID-like illness, but haven't been tested. The 35 of those have recovered, so that means we have 25 sick individuals currently. That's where we are statistically wise here in Carbon County and throughout the state. And I would just like to echo Christina at this time. We are doing the best we can. We're working a lot of long hours, and we're trying to serve our community in the best and honest way we can. So I will pass it on. Amber.
What would you like me to talk about? Just our efforts in the jail? Is that what you want me to do? Okay. So our efforts in the jail, we are currently screening all of our staff every day. Every person that walks into this jail is being screened. Every visitor, vendor, we're strictly screening those. All of our inmates are being screened before they're allowed to come into the facility. As far as in the jail, we are all wearing masks. All of our inmates have been provided with masks. We're doing pretty good in here. I mean, we don't have any COVID-like illness in the jail, and I think that that's largely in part due to our efforts to make sure that we're taking every precaution that we can to make sure. We have similar to the nursing home, we have a setting in which should the virus get in, that it could be pretty catastrophic for us because of our close setting. I mean, we just don't have the square footage or the ability to do a lot of significant isolation that would require. So we're really trying to amp up our efforts to make sure that we don't have any illness in the jail.
Jessica, did you have anything you wanted to add?
I'll just talk about, in general, I'd like to remind and encourage everybody to stay vigilant in your efforts to slow the spread of COVID. Remain 6 feet apart if you can. If you can't, wear your mask in public. At work, if you're in a work setting where you cannot remain 6 feet apart from your co-workers. Continue with your hand sanitizing and your washing your hands and your sanitizing any tools you use, your doorknobs, your computers, light switches, everything like that. And our numbers in Carbon County seem pretty small, but there's a lot more people out there than anybody knows about that's reported to our public health. So it is here, even though a lot of people are denying that it might be. We do have it, and let's keep ourselves, our families safe.
Mike, you wanna?
Yeah, I'll jump in for a minute. First, I'd like to just pass on some of the kudos. Okay, I'll use my coaching voice. First, I'd like to pass on some kudos to a variety of number of people. Our students and their parents have just done a tremendous job in trying to make sure that students have stayed engaged with their educational progress during this time, and I want to thank those families and thank our students for that. Our teachers have just put forth tremendous effort to continue to try to learn and provide good services to our kids. Our food service and transportation and technology department have just been over the top with making sure that families have devices, they have connectivity, they have food, they have things that they need to be safe and to be cared for. And just in general, I want to really thank our whole community for what's happened from an educational perspective. Now, we are into May, and so we don't have too much longer left in this school year. We are looking at how we can perhaps bring in some smaller groups of kids for some individual instruction. We're not ready to announce that just yet. We're still working with public health on what conditions may need to be in place, and we have to submit a plan to them and have it approved by the state health officer. But the wheels are in motion to have that at least in progress at this point. And so there may be a little more to announce on that in the not too distant future. And we're also planning for what some extended learning opportunities may look like into the summer. If we are allowed to have some groups of kids, how we might be able to provide some more meaningful time for them in face-to-face kind of settings, and what precautions would need to be in place. So those are some of the things that are taking place on the educational front.
Okay.
Well, just a couple things. First, we'd like to express appreciation to the residents of Carbon County. This has been a challenge, and we're talking about it from the health side and the school side, but staying home, keeping your distance, wearing your masks make a difference, and has made a difference. The concern is we early on did not have the ability to test everyone that we would have liked. We had very limited resources, and the state had very stringent guidelines. So a number of individuals who probably had COVID were not tested. Our governor has been doing a wonderful job working with a lot of folks, and we are now starting to see more test kits come available. The standards have now been relaxed, and so if someone has symptoms, they now can get tested. In the past, they had to have symptoms and risk factors. So now it's just symptoms. And so our numbers are a little lower, and we are grateful they're a little lower. And the reason they're a little lower is, one, people are being careful. Two, we haven't tested everyone. And so just because we're starting to relax some of the standards, and our governor has said it's now okay to go get your hair cut, which I clearly have not done yet. And some of those other things are getting relaxed. That doesn't mean that we can let down our guard. There is not a vaccine yet for COVID-19. I know our federal government and a lot of organizations are working to get that done. We anticipate that we will have COVID for a while longer. And to be honest, at the hospital, we're starting to put all of our plans together for next year's COVID season. This is not going to be a one-time deal. Until we have vaccines out there, we're going to have ongoing needs. So I guess the thought is we're thrilled to be able to help, to do our part, and we're having meetings in Carbon County every single week where we're talking about how do we work together. What is the refinery doing? What are we doing? What's the nursing home in Saratoga or the clinic in Saratoga doing? What is the school district 1 and school district 2 doing? Every one of us are together and talking, and we're trying to put together the plans and work collaboratively to make us safe. So thank you to the residents of Carbon County for doing your part, and we promise that we'll continue to do our part as well.
let's do some questions.
All right. So, Ken, I'm going to follow up with you. Can you speak a little bit more about the testing options that are now available if someone were to seek out a test? What does that look like? Can you walk through that process?
I can, and Public Health may have to correct me because since I am not a clinician, so I'm one of the two in the back. They put the non-nurses in the back, and the nurses are all up front. We're just letting you know that. You would need to call beforehand if you're coming to MHCC. You can call the clinic, or you can call the emergency room, and they will do a little questions over the phone. And they want to do that so that they can make sure that they're providing the safety for those who are doing the testing as well. If you come to the clinic, it's very likely that you may be able to even stay in your car. They can come out, they will swab you, they will take certain vital signs, and then they will submit that test in to either the state lab or to Quest, which is a private lab company. We have the ability to have tests go to either place. If we have someone coming into the emergency room who is very, very sick, having problems breathing and things like that, we actually have some rapid tests that we can do and get a COVID result in about 15 to 20 minutes. But we have very limited quantities of those. We have about 40 of those tests, and so we're being judicious in using those only in the most sick patients or those highest risk patients. But everyone else could get a test done and it gets sent off to the state or to Quest, and we see some results coming back in 48 hours.
Add to that those are patients that are ill and symptomatic. We do not have a way yet to screen you to see if you've had the disease yet or not, or if you have no symptoms, there would be no way to tell. There might be a small percentage to tell whether or not that you were ill.
Yeah, because right now in the hospital, we have, I think about 240 test kits that we do for sick people who aren't critically sick. And I know that there are test kits available at the clinic in Saratoga, and there are test kits available at some of the other practitioners' offices, like Cedars Health in town as well. So if you're symptomatic, you can get tested. If you're not symptomatic, you're not going to be able to be tested right now. There's a lot of conversation around the country about antibody testing. Right now, those tests are not scientifically valid, and the medical staff and Dr. Abels, who leads our COVID steering committee, we meet, I think with Dr. Abels, it's only about 8 times a week right now. And the truth of the matter is we do not recommend, and we will not be using antibody testing until we have some better scientific studies and proof to demonstrate that they're valuable and that they give us good results. So be careful what you buy on the internet. There's some internet tests out there that says you can test. Some of them do test for corona, but you have to remember this is corona-19 or COVID-19. And some of those tests that you're paying a lot of money for on the internet are testing for some of the other iterations and not for this particular disease. So as soon as we know that there's an antibody test out there that is valuable, we'll certainly share that. But right now, there's not.
I think it's important to, I mean, there's so many people that are scrambling right now to try to, find a treatment and then find testing, diagnostic things, and so right now, there's really just not a lot. It's all under, being studied, and we probably won't for quite some time have anything that's gonna be, including vaccination, that's going to be, valid. That stuff's gonna take a while. There's many studies that are gonna have to take place before those things can be used with any amount of accuracy.
Do you have anything you'd like to add to that, Jackie?
No, they covered it.
Okay. So looking ahead to the flu season, we're a little ways away from that, thankfully, but how do you predict COVID-19 will play into the upcoming flu season? What would you say to that?
Yeah, we'll look at Jackie a little bit in front.
So, our COVID committee believe that until the vaccine or an antiviral is found, that this will be part of our flu season and that we will continue or we will see it again in the upcoming flu season. The recommendation and my recommendation is that even if you never did before, that when those flu shots become available, that you have them, you get them. Because to have the flu on top of coronavirus can be very devastating, and coronavirus on its own is very devastating. It will possibly help in the differential diagnosis in the future. If you come in ill and you say, well, I've had the flu vaccine, of course, the flu vaccine changes every year also, but my recommendation, and I'll let Jackie and everyone else feel, that this flu season would be the best time to start getting a flu vaccine.
Absolutely.
Because it's here to stay for a while, guys.
The vaccine is not, it's not gonna be anything soon.
Yeah, the coronavirus vaccine will not be for a while, although there's a lot of really brilliant folks working on it, a lot of organizations working on it, and, you know, I hope that they are able to get a breakthrough fairly quick. You know, you read things on the internet, and every night I go home and spend 3 or 4 or 5 hours or more reading journals and reading information from the CDC and others.
I think,
but right now we do not know.
I think that's one of the things that we wanted to get across to everyone. This is something we're going to have to live with for a while until those things do happen. I think it's easy to get used to something and forget what all the things that we've been doing in the last 2 months. We all understand and know it is very important for the economy to get up and going. So what we're asking to do is that while that is happening, that we not forget that we still need to social distance. We will still need to wear masks into places that as they begin reopening them and places of business. This is the best way that so far the country has found and the world has found to keep us safe. So while we know we're going to try to get back, as they say, to business as usual, it will still be a new business as usual. So we want, one of the reasons we got together is because we all felt it was really important to remind our county and everyone that we cannot stop the processes that we have in place. As far as the hospital is concerned, we'll have talks in the future, but you may not see the screening when you come into our clinics and our hospital going away. The same things for the jail and other businesses. In fact, my guess is as we open more and more throughout the country, you'll see more of that in more places.
I think that was the purpose of this meeting. I think all of us felt that we don't, with the governor opening everything up, we really want to stress that people not have false reassurance. I think Dr. Johnson spoke of that quite a bit yesterday, but that is a huge concern that people have a false reassurance just because we're starting to try to open things up. That does not mean that this has gone away. In fact, this week is our projected peak for the state of Wyoming right now. So more than ever, we need to use our precautions, do our social distancing, wear your mask when you're out in public. The mask isn't, of course, a fabric mask isn't going to prevent it, but it definitely does buffer it. And so the projectile when you cough or sneeze is much decreased. So you're looking at like a 2-foot space between you and another person versus a 6-foot. And so I think that's why we just wanted to get together and just make sure that people are aware that because the county's, because the state's trying to open up things does not mean that we need to relax. In fact, we probably need to get stricter. As Christina mentioned, we're probably going to see a spike.
Absolutely. And I wanted to point out too that a lot of people feel this is only going to affect elderly people, but it affects everybody. People have died of all ages now. People have become very sick. People with things like asthma. I had pneumonia 2 years ago, so I'm scared of getting sick. It can affect anybody, and it has killed people of all ages. So
I think it's really, as we learn more, and I realize in the beginning we said the elderly, of course, are always greater at risk, but it is important what Jackie said, is that, while it is not as, children are not as affected, and we don't know why, children still are getting sick. Some have died in their 20s, 30s, teens. So it is not just an old people disease, and I'm old, so it's not just a disease for me. So, no, go ahead.
I just wanted to kind of throw in there that, we all have elderly people in our lives. And so even if, you're yourself not concerned or scared, you need to think about the other people in your lives, or the people that you're running into in Walmart, because we all have to go get groceries, and so it's I don't know, I kind of want to say it's not just about you, it's about the other people.
And it should be clarified that any one of us can get it. It's those people in the higher risk factors, the elderly, the people with underlying respiratory cardiac issues, obese people, that are going to get severely ill when they get it. If we get it, we're going to get sick. It's those people that are going to be affected more greatly. And I can actually be sitting here with it and not even know I have it. I could never show any signs of it, but I could go have dinner with my dad, who's elderly, and get him very sick. So remember your family, your friends.
Are there any new symptoms that people should be aware of and be watching for? Has anything changed regarding that?
I've seen some things about the feet.
So there are some things that we are slowly finding. We don't know if they weren't there before, and we just don't know that because we don't have all the information from Europe and Asia. But yes, there is. We have found that you can have strep and have COVID-19. You can be extremely fatigued. There is a syndrome called comfortable hypoxia. Would you say that was the best word? Where, it's silent hypoxia, comfortable hypoxia, pleasant hypoxia. But where we would normally see a patient who had an oxygenation, O2 sat at 20 to 30% would be in our ER and trauma, and we would be resuscitating. People can actually walk around with an O2 sat of 20, 30, 40% and feel totally fine, except they might feel extremely fatigued. So fatigue meaning I'm extremely tired. This is more tired than I normally am. The Dermatologist Society have been finding strange rashes. I can't speak to that directly and what type those are. So as time goes on, in the beginning we didn't know there was a loss of taste and smell with this disease, and as time has gone on we have found that that is to be true. We did not understand at the beginning that there would be GI symptoms such as vomiting, nausea, diarrhea, but we find now that is also true. So unfortunately, this isn't like the measles, and you get that rash and you know what that looks like. It's a little bit of everything, and not everybody has a fever, not everybody has a sore throat, not everybody has a cough, and not everybody has anything. Some people just have one symptom. So it's important to understand that and realize that.
That's how viruses mutate themselves to infect the largest number. I mean, that's their goal, is to infect the largest number of people, or whatever their source is, but of people possible. And so they will change, and it will be different in everybody, because if there, for example, like with the measles, if there was something that was like, oh yeah, I have this, then it would be a little bit easier to deal with, but this is not, and that's what makes this virus, unique and harder to tackle.
So that's why, as Jessica said, you don't know what you have. You may think you just have allergies, and it's not just allergies. So if you are concerned, I think we would all recommend that you follow up and call a provider ahead of time and let them know that you feel like you're ill and you're not sure, and let them see you.
So with that, then, if you're concerned whether it may be allergies or maybe you you have another chronic disease that you're trying to manage and deal with, but you're concerned about going into the clinic at this time because of COVID, what would be your recommendations to help people still monitor and maintain those standards of health so that they don't become worse?
I can answer that. First, I think it's absolutely okay to recognize that there is a level of fear, and that's okay. You can call the clinic, and we do have the ability to do telehealth visits through the Wyoming Telehealth Network. We can do similar to what we're doing here, but it's more of a Zoom type HIPAA-protected environment where the practitioner can visit with you and talk about the symptoms. If you're interested in that, when you call the clinic, ask for them to set up a telehealth visit. Secondly, I talked about earlier, we have the ability to have people come in and potentially stay in their car. We can go out to them with the proper PPE on. We can check their vital signs, ask some questions, and if necessary and they're symptomatic, do the nasal swab and other things to be able to do the test. So the answer is the worst thing you can do is to do nothing. If you're absolutely not willing to go in, we have created a sick clinic and a well clinic so that we have environments that are less likely to have COVID. But if you're sick, you're not going to be going to the well clinic anyway. You'll be going to the sick clinic. We can have you in your car, or we can have you either on the phone or on a video call.
And Ken, for the public's clarification, which has been designated as the sick clinic versus the healthy clinic from an MHCC standpoint?
Currently, the MHCC Healthy Clinic or Well Clinic is over at the Wagon Circle on Elm Street, and the clinic that is historically our MHCC Family Practice Clinic is where we're seeing the sick patients.
Thank you. All right, and we just had a comment regarding that. The clinicians have been amazing. I've had phone follow-ups and everything. Call them. So someone from our public has experienced that directly. That's wonderful. All right, so is there anything else that the panel would like to add? We have not had any questions come through specifically at this time, aside from what I've already asked. Is there anything that the panel would like to add?
I think they need to know that as far as our hospital is concerned, that our providers they have all the up-to-date information. They are on videos, they are on Zooms, they have certain sites that they go to, they are reading, and I will tell you from everything that I've studied, our providers at our clinic and our hospital as up to date as they possibly are in New York. They are following things that happened in New York for treatment. I don't want anyone to think because we're in the middle of Rawlins, Wyoming, that we're not up to date on treatment. But they are probably as knowledgeable as anybody as if you went to a bigger city. They know, our providers have their own Zoom meeting every week where they discuss treatment. What have you learned? What have you heard? What can we do different? And I think it's really appropriate to give a shout out to all providers in the county, and I am saying all of them, but I only know most about mine, and I call them mine, but from OB to our surgery, and we are looking, and I'll let Ken speak more to that, about slowly opening up our surgical department. But again, I want to reiterate, public health is giving you the information. They're directed by a public health officer in the state of Wyoming. We all have people we answer to, but if you know any of us, you know we're pretty independent anyway, and we will always give you the honest truth as we know it, and without any political agendas, and we need you to understand that. And I will also say, as far as HIPAA is concerned, and Jackie can speak more to this, and can correct me if I'm wrong, of the 1135 that the president, that the government put out, gives us some leeway with HIPAA. And that leeway is my speaking to Jackie, my speaking to Amber, my speaking to anyone else. But it does not give us leeway to the public. We will tell you that information that you need, and regardless of what the numbers, as we said earlier, COVID is in our community.
All communities.
All communities,
Yes.
whether it's Saratoga, Baggs, Medicine Bow, Hannah, it is here. So what you need to know more than specifics about who these patients are and where they work and what they do, that's what public health does. They'll take care of that. If they feel that you were exposed, they will let you know. But if you don't know and you aren't at risk, then you don't need to know.
There's a lot of stigma involved in a
Mhm.
positive diagnosis. I think the best thing at this point to do is just treat everybody like they're positive. You know, that's a standard precaution that we're taught in the medical field. Just treat everybody like they're positive.
Absolutely. And it's important to get your information from the correct sources. We had several national websites that were reporting us as having 48 cases. That is inaccurate. If you go to my Carbon County COVID-19 response Facebook page, I put out a daily debrief every day, and it has almost any information you'd want to know. It has the amount we're monitoring, it has the amount of probables confirmed, how many out-of-state people we're monitoring as well. So I am covering everything in those daily debriefs, and that to me is the most accurate information you could probably get. We also have a website that we've referred to you about as well, but that does not have the ones that we are monitoring that were from another location. So get your information from the correct sources. Those national ones are lovely sites, but the problem is sometimes we have a Carbon County, Pennsylvania. So this is just a guess, I don't know for sure, but maybe they mixed our numbers up with Carbon County, Pennsylvania. They don't have the direct local facts, and everything should be in those debriefs every day. When we do get a positive case, I put out a debrief about that with as much details as I can give the public. And like Christina said, I am doing my best to protect HIPAA in this county. I know that other counties have released a little bit more specifics on which town, but our county is very unique. We have a big county with lots of little towns, and little towns like Riverside, Elk Mountain. If we had a confirmed positive there and we put that out there, everybody in town would know who that was. It would not protect the public. So that is the reason why we've chosen to disclose what we have. So, and that won't change. And if anybody, I know I've had some people really concerned about that, they are welcome to call our Carbon County attorney, Ashley Mayfield, and she will discuss it with you further. So, yep, that's it.
I think another thing to note too is because we, as a state and a county, are kind of on the tail end of this. You know, we're our peak is projected quite a bit later than some other places. We have the advantage of seeing how other places, you know, similar in size, or places like New York that were hit really, really hard. You know, we have the advantage of seeing what they did and what they should have done differently, what they, you know, and so I feel like we are in a pretty good spot right now to handle this. You know, and public health has done an excellent job of trying to keep the public informed, trying to give us all accurate information. Janessa's done an amazing job at the nursing home. What she's done over there is very commendable. Her staff, not just Janessa, but her and her staff have done over there is very commendable. And I mean, the fact that we don't have any positives in that facility is pretty amazing, really. It's because of their efforts to do what they're doing.
So, Ken, I'm going to turn this back to you. Would you like to speak to, I know we've had a lot of questions from the public regarding elective procedures on, various levels. Can you speak to some of the hospital's plans in terms of when we anticipate beginning some of those again?
Absolutely. I mean, and this goes back to the fact that as individuals and as community, we're not simply dealing just with COVID-19. We still have underlying health issues with heart disease, with pain associated with bad knees or bad hips or back pain. All of these kind of conditions are still there. For safety reasons and to preserve some of the personal protective equipment that we use and have and continue to use for our staff at all of our organizations, the governor came out with a recommendation, actually a request, and we and almost every hospital in the state stopped doing elective surgeries and other elective procedures. But we're getting to the point where many of these individuals are continuing to have pain, have now gone for a month or two. And so the organization has put together a very thoughtful process, driven and really by our infection practitioners and mostly our physicians as they sat and looked at what are we doing. I can give you a preliminary, much like Mr. Hamill talked about. We're in the process of finalizing this document. We'll be submitting it to our county health and getting their feedback and input as well. But right now we're anticipating starting to do elective surgeries and elective procedures on May 14th. The intent is that we will, for anyone who's coming in for surgery, we will actually test them about a week before for COVID disease. And we will then have a screening process where we talk to them the day before, we talk to them the day of. And if they start showing any signs or symptoms, we're going to delay those cases. We also have a very specific process in how we're using PPE. We have a very specific process in terms of how we're having them come into the organization to make sure that we protect them, that we protect the staff. That's phase one. Phase two, which will be sometime down the road, would be inpatient surgeries. Right now, we're not going to be doing inpatient surgeries unless they're emergent, life-threatening surgeries. And phase three, which is, do we go back to the world that was before where we didn't do all of the screening? My guess is we're in a new world and we never have that phase three. So I think we'll start doing surgeries tentatively on May 14th for outpatient surgeries for people who are not symptomatic, and then sometime down the line, yet to be determined, we'll be doing other surgeries. But as we come back to kind of the beginning, what Christina talked about from my perspective is every single one of us have an obligation not just to take care of ourselves, but to take care of the community. The reason we're having this Facebook Live event is as the community and others are starting to get a little COVID tired. I can tell you, I was talking to my wife on the phone this morning, and I'm tired of COVID. I would really like to not go to 8 meetings a day talking about COVID. I know the school would rather have the kids there.
Absolutely.
There's all of us, I'd like to go down and sit down in a restaurant that I like to go to and eat. I can drive up and get the stuff. I guess now I can even walk in and pick it up, but it's different. And it's okay to recognize that we're tired. But that tiredness, and the reason we're having this meeting is, folks, we still need to be diligent. We can't let our guard down. One person who has the COVID disease can create a major problem in Carbon County. If one person has the disease and doesn't isolate, one person has the disease and goes out and interacts with another person, we then start to see the spread. That's what's happened in those nursing homes around the country. And that's why we're proud of both nursing homes in this county and the great job both of them have been doing to really isolate those nursing home patients. We haven't had a nursing home death, but I was reading of a nursing home that had 70 deaths in this country because one person got the disease and was not careful. And while we're fortunate right now because we've been doing a good job of isolating and having social distancing and wearing masks and cleaning and using hand sanitizers or soap and water, if we let our guard down, we could be in the thick of things, and we don't want to be.
I think we all are gonna be adjusting to a new normal. I don't think we'll ever see it go back. Everything's gonna be more cautious, everything's gonna be more careful, for the foreseeable future. We won't go back to the old normal, in my opinion.
Agreed.
Okay. So for the public, if there are any other questions, we're nearing the end of our time today, but if there are any other questions from a public stance, please feel free to submit those. And if you think of something after the fact, again, go ahead and submit on this same Facebook event, and we'll be sure to distribute that to the appropriate person and get you an answer. We have, just for your knowledge, we've had several positive things come through. Thank you all for what you do. God bless you all on the front lines and for giving us updates. You are appreciated. We've had several comments similar to that. So thank you all for thank you for your kind words. And so it looks like we're not having anything come through just at this time. So we'll go ahead and close for today. Thank you again for joining us, and stay tuned for future events. Thank you.
Thank you.